What does it mean to have a plica in your knee? And how can you get over the pain from it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. And I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the more common diagnoses really of the 80s, 90s, kind of the early days of arthroscopic surgery was a plica within the knee. Now, this is a band of tissue. It's not to get too technical, but it's a remnant of how the knee, when you're a baby or even as a fetus, your knee is separated into these compartments, and it's the tissue that basically held it into compartments. But as you start to grow, those compartments resorb and it becomes one undivided knee cavity. Now, in a small percentage of the population, there's still these bands of tissues that are remnants of that in various parts of the knee, although it's usually on the inside, or what we call the medial aspect of the knee. I said it's pretty common. Depends on the studies you've read, but some people say 5% of the population has it. I've heard as high as 25% of the population has it. When I do scopes of the knee for meniscus tears or ACL tears, I probably see it in 10, maybe 15% of my patients. Here's the thing, a whole lot of those people, probably most of those people, don't even realize they have it. So you can have a plica in your knee and have no trouble at all. And that's one of the reasons surgery for a plica has really fallen out of favor, is that, again, very often people have them and that's not even the cause of their symptoms. Now, occasionally it can be symptomatic. That band of tissue can get inflamed because of sports or exercise and can cause this nagging discomfort, or sometimes even a clicking or a catching sensation, especially again on the inside of the knee or the side closest to the midline. If you're looking at the knee, here's my little knee model. I don't know how well you can see that, but you're looking at the kneecap there. This is the inside of the knee. This is the outside. It's a band of tissue sort of along the inside of the kneecap there, and it can cause a lot of pain. Now, typically, if we're suspicious that that's the cause of the symptoms, we can do things to try to decrease the inflammation, things like physical therapy and maybe some modalities to that area, strengthening other parts of the knee to stretch that out, but also decrease stress on the plica, and that's enough to get it better. A lot of times ice, anti-inflammatory medications can help. Sometimes, occasionally, we'll even inject cortisone into the plica to see if we can decrease the symptoms. Very rarely, and I probably have to do this maybe once or twice a year, people just fail to get better. And if we're convinced that that's the cause of the problem, you get an MRI and you don't see anything else like a meniscus tear or something like that, occasionally we can go in arthroscopically and take a shaver and basically take out the plica. That can work really well if that's the cause of the symptoms. Now, it takes some time to get over that. The knee swells a lot after that surgery. There's a lot of discomfort. But again, if that's the cause of the symptoms, that can get you better. Then you do a course of physical therapy for strengthening and range of motion and return to sports activities, and you can get better. Again, it takes longer than you might think. So I've heard people say it took 3 or 4 months to really feel normal after that surgery, even though it's an outpatient surgery through a few little poke holes. But again, most people don't end up needing surgery for that, but it's worth talking to your doctor about it to see if that's the cause of your symptoms, and if so, what he or she thinks you should do about it. Okay, have you had a plica, or do you have a plica in your knee? And what kind of trouble is it giving you? What treatment or treatments did your doctor recommend? I'd love to hear your experience, and I bet people watching this video from all around the country and all around the world would love to hear your experience as well. So below this video, share your experience. I'd love to read it, and I bet people would love, especially if they're dealing with this problem, would love to hear what you have to say as well. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my video channel. Click the subscribe button in the upper right corner of the page on YouTube. I record a couple of these videos every single week, and they'll get delivered directly to you. Thank you so much for watching. I hope this was helpful. If you have Plica syndrome, I'd love to hear your experience, and I look forward to seeing you right here next time.